Hi, this is Sue Field from Health Force Minnesota, and I'm representing here the Minnesota Simulation for Healthcare Education Partnerships. And this is our webinar today, and as you come in, you'll be on the listen-only mode for audio. Use the chat feature for any questions, and this session will be recorded and archived up on our healthforceminnesota.org website. The resources for this session can be downloaded directly from this webinar. Up in the upper right-hand corner, you will see a PDF that says Feel the Surge. That is a copy of the PowerPoint itself, and if you highlight that, you can download that file. Also, there's a link to the survey in another attachment, which you will be able to download as well. I see that we've got people that are letting us know what settings you work at. So there is a poll here. And while I read the bios for this session, please go ahead and let us know what kind of background you are coming from. So today we're really happy to have Kimberly Hinrichs. Kim has worked for Allina Health for the past 16 years in various roles, both as a staff nurse and in learning and development. She served as a simulation consultant and worked to create a simulation program for the system. Kim is now the supervisor of simulation at Allina Health. Her role includes program development, direction, and provision of simulation training for relevant staff educators, providers, and intraprofessional teams. Kim has her BSN from Bethel University and her MSN in nursing education from Gonzaga University. Kim has a vision to provide simulation opportunities throughout Allina Health that prepare our staff and providers with the opportunity to improve patient care and patient outcomes. Next is Kathy Wagner, who has worked for Allina Health for 22 years, beginning at United Hospital, where she spent 18.5 years as a staff nurse in labor and delivery. Kathy loved being a preceptor for new OB nurses, and 3.5 years ago, she joined Allina's Learning and Development team as a Learning and Development Specialist for the Mother-Baby Clinical Service Line, creating education and simulation opportunities for OB nurses across a large health system is exciting, she says. Erin Cox has been working in the area of normal and high-risk obstetrics for 16 years and holds a certification in inpatient obstetrics. She has worked at both metro and regional facilities across the country as a staff nurse and as a travel nurse. She currently works as a learning and development specialist for the Mother-Baby Clinical Service Line at Allina Health, where she supports obstetric education across the 13-hospital system. Erin helps coordinate Allina's obstetric orientation program, and along with Kathy Wagner, facilitates annual simulation training for both providers and nurses across the Allina Health system. We're really happy to have all three of you with us. And as you can see right now, for those who've responded to the survey, we've got about an even amount of academic and clinical providers here. And we'd like you to fill out one other survey for us as Kim gets her PowerPoint up, and that is a poll that asks which area of the state you are located in. Are you in the metro area, rural northwest, rural northeast, rural southeast, rural southwest, or central Minnesota?
All right, thank you for answering that, and thank you, Sue, for introducing us. If at any point anyone has any trouble hearing us, please say something in the chat, and we'll do our best to get closer. This is Erin Cox. I'm going to get us started today. And right now, Kathy and Kim and I are kind of huddled around a Polycom. So if you have any trouble, just let us know. Wanted to start with just sharing our objectives for the day with you guys. So we want to make sure we're identifying or helping you identify a benefit of orientation standardization across a large health system, how to use multiple learning modalities to create an experiential learning event, and then hopefully describe an opportunity where you can use simulation-based learning in your orientation process or whatever area you're working in. So just a few disclosures to start with. We felt we had to share with you all that we shared a cubicle for a year. So we have an interesting friendship and relationship as well as being colleagues. We've been on the road together providing education and doing a lot of simulation. Kathy and I this spring did simulation for about 800 nurses and 150 providers over 3 months. So we spend a lot of time together, and because of that, we do tend to finish each other's sentences and get a little bit goofy when we're together. So just to give you guys a visual of us, over on the left with that fabulous laugh is Kim Heinrichs. Up in front in the dark blue scrubs is Kathy Wagner, and I'm the one right behind her with the bangs. And then with us is obviously our patient Lucina, who we have come to love and adore, and then two of our other colleagues here at Abbott Northwestern. So I wanted to give you a little background about where we started before we did this orientation standardization. We weren't starting from scratch. So Kathy and I both work for the Mother-Baby Clinical Service Line as learning and development specialists. Allina has 13 hospitals. 11 of those have birthing units. And we were fortunate enough when we both came in that there was already a spirit of collaboration and standardization across Allina. So we do have a couple of groups that existed before either of us were in our role. The Allina Pregnancy Care Council, which is a group of leaders, providers, nurses who get together and discuss best practice and make sure that we're doing things standard across the system. They've been meeting for a number of years. And then there was already a group of OB leaders, so managers and directors from across the system that met on a regular basis. And there was already an established group of OB educators who met monthly from each of the sites. And so we really started with a good foundation and found as we did this work that was really essential to rolling out a lot of this work, I think. The push with this orientation standardization really began with a partnership between Allina Health and Children's Hospital. They formed a partnership and decided to create the Mother-Baby Centers. So in February of 2013, the Mother-Baby Center at Abbott opened. And then in 2015, we had 2 sites open, the Mother-Baby Center at Mercy and the Mother-Baby Center at United and Children's in St. Paul. So 3 new facilities really created quite an expansion in our program. They also, with that partnership, developed the Midwest Fetal Care Center, which increased our number of high-risk deliveries. But just opening these 3 facilities really increased the number of deliveries we do and therefore the number of staff we had to hire. We've really seen quite an increase in our census with these openings. The Mother-Baby Center at Abbott actually had a 23% increase in the number of deliveries they did the first year they were open, and in St. Paul they had a 12% increase in their first year. And that growth is just continuing. So we found, as part of the service line, we really had a need to hire a lot more nurses. In 2011, we hired about 64 nurses that year, and then you can see in 2013, that first year that Abbott's Mother-Baby Center was open, we had 135 new RN hires. And then in 2015, when the other 2 Mother-Baby Centers opened, really jumped up again to 124, 139 in 2016, and that growth is continuing. So what we found is that the process we had set up, which was a good one, was not enough to accommodate all these new hires. We had a standard orientation series of classes, but the classes were filling up. We weren't able to offer it often enough. We weren't able to find enough preceptors or enough instructors. And so we were really in a position of needing a new plan. Meanwhile, Allina Health had a workforce planning group that got established who were looking at a lot of things that really were going to impact us, including where does Allina source their talent, how do we help retain people, make sure that people we're hiring and investing in want to stay with us. And so Mary Olson was a senior learning and development specialist with that work. And because Mother-Baby had an established clinical service line with groups that met regularly and a already had a standard orientation process, they decided to kind of start with us. And her work is now moving on to other specialties, but did start with OB because we had a good foundation to start with. So we really, as we worked with her, started talking about, number one, where do we source our talent? Where are we hiring from? As we were hiring all of these numbers, we were running out of a pool to hire from. So we really had to start looking at how do we support hiring new grads to specialty, which we hadn't always done in the past. And then I think the biggest one for us was that one in the middle of, is the training we're providing effective? Are the classes we're offering really the best classes, and are we doing them in the most effective way to really prepare our nurses? So that group with Mary and Kathy and I and Kim got involved, and then we had some site representatives involved, and we met over the course of about a year to work on recommendations to make that training most effective and give us the most for our money and our time. We came up with quite a few recommendations. We're not going to talk about all of them with you, but I think the two biggest buckets were to really work on resources for the managers to standardize what education was provided. What we found is that as there was turnover amongst managers and supervisors, even though we had an established process, not everyone followed it the same way. So we really wanted to give them a resource, which we ended up calling our OB Quick Guides, for what orientation should look like and how to tailor it for different learners, knowing that what a new graduate needs is very different from someone who's coming with experience in OB and is just learning our facility. So we came up with some OB Quick Guides that really highlight, based on if they're a regional or a metro, what classes they should take, what e-learnings they should do, what their orientation number of hours should be, to really try and give our managers a resource. The second and probably biggest bucket of our work, I would say, was around our orientation classes. We ended up changing the audience and timing of quite a few of the classes, knowing that we couldn't continue to offer them all the way we had been because we were too full and not enough instructors. So what we did is we looked at which classes needed to be offered more often versus which ones could be offered less often. And we made kind of a tiered learning so that there were introductory level classes being offered every other month. And then the more advanced classes that built on practice, we only offer a couple of times a year now, so that the learners can come with some experience from the unit, and it actually makes it a lot more valuable class for them. We also started focusing more on a flipped classroom, so we found a lot of things we were teaching in orientation classes that the students really needed to know from day one on the unit. Things like how to read the fetal monitor, how to do an infant assessment, how to do a postpartum maternal assessment. And so we created a couple of e-learnings that they do day one, so then our instructor-led classes could really be more focused on experiential learning. And that's what led to the creation of our OB Orientation Simulation Day, which is kind of our focus for today and what we wanted to tell you a little bit more about. So this is a day that we created. We're offering it every other month. And it is really designed for the new graduates and the experienced RNs who are new to the specialty. And I'm going to let Kim talk about the design and how we came up with what to include in that class.
All right, so our objective was to really provide a number of active learning modalities. We wanted, of course, we wanted to use simulation, and I was a big proponent of that, but we also wanted to do some other active learning modalities such as case studies and a lot of hands-on practice and then a lot of small group discussion so that there could be kind of a higher level of learning, and as folks were listening to a leader and kind of responding and asking questions in a safe environment. And in terms of kind of the areas that we really wanted to focus on, we wanted our new OB nurses to focus on early recognition of some of these situations, calling for help, when to call for help, and then communicating during the event. So those were our I would say those were our objectives within each of the topics that are listed below. And through needs assessment, through the needs assessment process with our mother-baby service line and our unit educators, we came up with the following topics to focus on for OB orientation OB simulation day. So the first three, the shoulder dystocia, postpartum hemorrhage, and the neonatal code, we chose to do a simulation. And then the diabetes, preeclampsia, the Leopold's and positioning, and then also our online system resources, we used those as skill stations. And so I'll be describing each one of those topics and how we implemented the education. So our first one is the shoulder dystocia. And our objectives for this one were to recognize the risk factors and the signs of shoulder dystocia, and then to demonstrate the correct application of the shoulder dystocia maneuvers. And while there are a lot of different maneuvers out there, we wanted to focus primarily on the suprapubic pressure and then the McRoberts maneuvers, which is where you pull the legs way, way back. And as you can see in the photo, Lucina is in the process of getting into McRoberts right there as she's getting ready to deliver her baby. And in the pre-brief, we really focused on practicing each of those maneuvers so that while the students were, or while our learners were in the pre-brief, they were not only learning about the mannequin and the environment, but they were practicing those maneuvers on Lucina so that they knew where you apply suprapubic pressure, how to actually move her legs, and then how you kind of what you do then in the actual situation. And so they come into this scenario having the information that they need. We're not just blindly throwing these new nurses into a simulation that they've never, or a scenario that they've never had before. The second topic is the postpartum hemorrhage. And our objectives for this one were recognition of postpartum hemorrhage and application of interventions using the postpartum hemorrhage checklist. And then additionally, we talked about pharmacological measures to treat uterine atony. And in this scenario, we really just, again, in the pre-brief, we focused on actually how to use the postpartum hemorrhage checklist, the fact that each unit has its own hemorrhage cart, and we wanted them to go through it to see what was in each drawer and where they would get all of their interventions that they could apply, including a little scale that they could be weighing all of the pads on. And again, in the pre-brief, we had them feel the firm uterus of the mannequin so that they knew what firm felt like, and so that when during the scenario when Lucina became very boggy in her uterus, then they knew that they had to start applying some interventions there. All right, and the next topic was the neonatal code. And I was really excited. We've done neonatal codes with this group before, but usually it's kind of the whole gamut, kind of like an NRP scenario. But in this scenario, we decided to focus on initial steps of resuscitation and really just providing correct administration of PPV. And for those of you that know neonatal care, administering good PPV will automatically, most of the time, raise your heart rate and your SpO2, alleviating the need to apply chest compressions to an infant. So if we can just teach them to keep it simple in the assessment, reposition. There's some assessment tools that we learned through NRP, Mr. SOPA, if you're familiar with that. But we wanted to keep it simple for them so that they understood. Just really focus on getting good air into the lungs and inflating those lungs, and you're going to have, you're going to get an increasing heart rate. So that was really what we drove home in the neonatal code. And then, so after those three scenarios, we'll show you the schedule in a bit, but they're moving all day long, really quickly from section to section. So their minds are just kind of very overwhelmed by the end of the day, by the end of the 6 hours. But this particular topic of diabetes, we had, as you can see, this lovely setup in another room of our sim lab, and we discussed the differences between diabetes, both pre-gestational and gestational. We demonstrated the IV setup for insulin infusion during labor, and also adding in, your LR and your, perhaps you have Pitocin and different things like that. So how do you get all of that into the patient safely? What's the correct positioning, et cetera? And then we also talked about utilizing the hypoglycemia algorithm to manage the baby's glucose. So this again there was some didactic portion to it where just in small groups, one of our OB leaders described, the process. You'll see in the next slide that we had a poster that they were able to focus on during that didactic portion. They could also receive a copy of the poster just on a Word document and take that home with them so they could remember. But I just love the way it's sectioned out, the image of your little pregnant patient there and how all the IVs fit in, and then they had a chance to actually put all that into use. They also had a case study of a newborn infant who was at risk for hypoglycemia, and then they had to use that algorithm in the case study and actually figure out what was the best treatment for this baby. So again, super practical, really great learning for our new nurses. And then our next topic was preeclampsia. Again, this was a skill station, and you can see a picture there of one of our new grads laying in a bed, and she is actually having a whole assessment done on her for preeclampsia. And so after a short didactic session with these small groups, they had a chance to do the whole assessment on the patient in bed, and the patient in bed held a little cue card, and then they kind of responded the way they were supposed to. So you could actually practice doing clonus and looking for reflexes and DTRs and all of that. So to actually have that opportunity to do the hands-on. And then they also had to demonstrate the setup of magnesium sulfate and do the programming the pump for both the load and the maintenance. And anybody who knows OB knows that's a stressful point when you really need to get that mag going and get it fast. And it's also a risk of toxicity. So what are the assessments that you need to do to watch for toxicity and while you're running magnesium on a patient? So just a really great learning. I just get goosebumps. I'm kind of a geek about this, but I love how active this was and what great learning it was. And boy, I wish I would have had this as a new OB nurse because I had to learn on the job. So, and there's our poster. You can see we talked about pathophysiology, some of the diagnoses. We don't expect you to be able to read all this. There's just so much information in these posters, but also physiologic changes you're going to see in a patient with preeclampsia. Just doing a good blood pressure, knowing, making sure that your cuff is the right size per patient. So some basic things, but great reminders. And then, of course, you have your head-to-toe assessment of your patient with preeclampsia. And then the next topic is the Leopold's maneuvers and positioning. So our objectives here were to demonstrate the Leopold's maneuvers to determine fetal position. So that's kind of the hands on the body over the mother's abdomen to determine what way the baby is laying in the uterus. And then to describe how assessment findings can be integrated into practice. So what do you do depending on how the baby is positioned in the uterus? And then also identify placement of the ultrasound in relation to the fetal position and in order to keep that tracing going during the whole labor. So it was a nice integration of task trainer. We had that Leopold's belly task trainer. We also had a cervical assessment task trainer so that they could feel the position of the baby, go check the cervix and see where the sutures were, again, in the head, and then figure out what do I need to do to mom in order to position her for optimal, descent of the baby. Thank you. For the baby really to descend and not get into a really awkward OP position. Sorry, kind of OB-ish language, but so really, again, super great learning. Even though it wasn't a whole simulation, it was a great learning with lots of hands-on. And then the last topic that we had was a scavenger hunt, good old scavenger hunt. But as as I mentioned in our overall objectives, we wanted them to know where the resources were, and that's always key, especially for a new nurse or a new grad into a specialty area. So they went into a small computer lab that we had adjacent to our computer or to our simulation lab, and then they had to locate some resources on the mother-baby service line on our ELINA Knowledge Network. That's what the AKN is. They had to locate certain policies and procedures. In terms of clinical skills, we use Mosby's, and so they had to kind of search on that website. Excellion is our charting, so they had to find different protocols and things on excellion.net. There was also an online library There's a lot of patient education resources there, so we wanted them to really search those different resources and be able to easily locate them when they go back to their unit. So with that, those are how we delivered each of our topics.
So this is Kathy, and I'm going to talk about really focusing in on the logistics of how we roll this out, because as you can see, there was a lot of work behind the scenes, with just doing a needs assessment and a lot of planning, and then when we figured out our topics and we had ideas, we're going to do simulation versus skill station. Now we have to put it into action, and so what does that involve? And so really that we looked at 5 different buckets of work, you could say. We needed to find space and talk about space, looking at the equipment that we were going to need to execute this day, making sure we had an agenda that flows well, getting enough facilitators and sim operators that we can, again, run this day, and then any kind of administrative support. So I'm going to go through each of those. So first of all was the space. And as you can see and kind of hear, maybe it's kind of rolling through your head a little bit when you hear several simulations. You're running 3 sims and, these workstations, what is that going to look like in a room? Do you have one room that this is in, or, do you have multiple rooms on different floors? All those questions were kind of coming into play for us even. But we were fortunate enough that our timing of this work was coming in line with actually really an increased need or request for simulation across our health system. And so leadership was really recognizing this, that this is the new way of educating folks, and they decided to put some effort into finding a dedicated space. So at several of our larger facilities, we have dedicated simulation labs. And the one here at Abbott Northwestern, right near where we're housed, they took the old special care nursery. So when Aaron referred to the Mother-Baby Center that was built in 2013, they literally moved, when that building was built, all of OB moved from Abbott Northwestern Hospital. The OB and the special care and the NICU all moved over to the Mother-Baby Center. So the special care nursery with 6 large suites has been sitting empty for several years, so it really kind of suited well for a simulation lab space. And so it has been since taken over and has been renovated, kind of in process, I would say. But the go live, we were really the first ones in there, and it was really a bare bones space with just 6, like I said, these 6 suites that had air, oxygen, electrical, some water, so we thought it was great. But the one thing we needed to do, and I put on here flexibility and creative thinking, when you have this space that isn't like a set-up sim lab like you're thinking, you just have to be very adaptable and creative when you're setting up your space. So we did learn that, and of course this space, like I said, continues to evolve because now it's really getting used for multiple other programs. And we've added now some debriefing systems and other things in it. So it's growing and changing, and every time we run our class going forward, we have to adapt with it. So, but it is exciting to have a space. As far as equipment, we are fortunate enough that we have several high-fidelity mannequins owned by our system. We have 2 Lucina mannequins as well as a newborn health, so we were able to utilize those for our simulations. But we also note that we have task trainers available, and as anybody who works in simulation knows, you always have to plan for the plan B. And we certainly ran into that a few times this year when our Lucina wasn't working the way she always should be, as we could say, or we had some broken joints or other things. So we always had to have plan B in there and how we were going to run that in case we didn't have our high fidelity mannequins. So really being mindful of that and planning for that and making sure you have that equipment available. Supplies for the stations, as you could see in some of those photos before, it just involves having IV bags, IV tubing, whether it's, a bed just to lay a patient in if you're going to be practicing that. We needed IV pumps and poles, and that's really where the rentals come into play because those sorts of things are very expensive for a simulation program to own. They're in high demand from the hospital, so we can't always count on maybe being able to pull them off of a unit. So we did some research, and we were able to find that we were able to actually rent them from an outside vendor. So we do have IV poles and pumps delivered whenever we're going to have our class. We use them for the day, and then we're able to just return that equipment. So next, as Kim was talking, again, you were probably thinking, look at all these stations, and how is that going to look, when you run a day. This is just an example here of our of our agenda. We had set it upon a 6-hour day, what we were going to do, so that we had time for setup and tear down on the other side, for the facilitators. This example is for our largest class. When we had 24 students, we decided to have 4 groups of 6 students. And as you can see, they just would rotate every half an hour through the day. And they do get a little time there for lunch, and they can kind of take some quick breaks in between stations, but they rotate this way. And we assigned our facilitators. They each would own a station, and that they would be prepared for just that. But the one thing we've learned through this process, I would say, is this: as we've done it, you can see, like, for instance, on Group 1 and Group 2, we've got the shoulder sim and shoulder debrief. And Group 2, you were running a shoulder sim while the other group is debriefing. We had to be really mindful of how those simulations go, because it's very tight. We learned that it's almost being run a little bit too tight, and we were talking about how we were going to adapt this again for next year and allowing ourselves a little bit more time to flip our room around and make sure that we have a little more time to troubleshoot if we have any issues with our mannequins or any other equipment, because we want to give ample time to the simulation as it should be. So sometimes we were feeling a little sense of urgency. So that's kind of one takeaway that we've learned as facilitators and as group organizers here of this program. But you can see that it's a lot of moving parts for the day, and it's going to take a lot of facilitators to do this.
And I just want to give props to Erin and Kathy, because putting this kind of schedule together is very, very challenging. And we have a lot of other groups, Kathy will describe in a minute, that come to us outside of obesity. We want to do a day like this. And I'm like, well, now we have the gold standard. I'm obviously really proud of this, but just putting all these components together and putting a schedule together that fits the size and the day, it's genius. And I'm so proud of these guys, because they have it down, and it's so organized, it's so clear, and it's working really, really slick. So that's my props to my girls.
Thank you. So the other thing, in addition to all the equipment and the space, is you need the humans behind the scenes in order to run this. So we look really, again, at two areas here of the facilitators to run each of the simulations and the stations, as well as the sim operators to operate our equipment. And as far as the facilitators go, the first thing we did with this was we went to the OB leadership across the service line, because we knew that we really were going to need their endorsement to send support to us to help us do this. Erin and I certainly cannot run this whole day alone, and we needed staff people, we needed supervisors, educators from our other sites to come in and help us run that day. So we did get endorsement from our OB leadership. They were greatly in support of that, and we overall had 24 slots, so to speak, 24 holes of facilitator need for the whole year. So we asked the sites to each pick up and support 2 slots per site. And for the most part, we had those holes filled. There were a couple of them that we kind of had to beg and plead for people to fill in at the last minute. And then sometimes over the course of the year, we have run into some issues with staff changes. People left, and now we had a new hole, or there were emergencies that came up. So we've had to learn to be very adaptable. And some of that kind of just goes back to our schedule even. And while that might look really pretty on paper, the schedule we had, sometimes we had to change it up. And maybe we thought we'd have groups of 6, and now we had to have groups of 7 or 8 in order to, because we didn't have the facilitators to do it. So that's something, again, that we've been learning. And what it's really done for us is brought to fore that we need to deepen our pool of facilitators. So that's a goal that we're working on for this next year, and really working with Kim and asking our educators, and again, we're going to be asking for some endorsement from our OB leadership, that they have some people that are dedicated to simulation and really learning this modality, and so that they can help facilitate. And if we need other helpers and other facilitators, that we have a pool of people to call on. So we've run into that. The other thing that we did as far as delivery was our facilitator guide. You can see a little snapshot, a very small one of that, but again, you work really hard to, create this content. We have these ideas, and we want to know, when you're having different people come in, there's always sort of your everybody can have sort of a little take or interpretation on something, and we didn't want that. We wanted things to be very standardized. We wanted the message that's delivered to be the same, for all the staff. So we created this facilitator guide, and it really outlines for folks, how much time they have, their objectives, the materials that they needed, and really outlined it in a step-by-step fashion how they're going to deliver this content, what they would explain, what they're going to ask, listen for from the students, if they're going to hand out a worksheet, what part is interactive, and the response that they should be getting. So this is what they had to prepare for their station or their simulation if they were supporting that. And it was very well received. People, I think, really appreciated that, and that they felt safe, I guess, even for them, that they were well prepared to facilitate their events. So that we felt was really a success. The sim operators, you can see Kim there running Miss Lucina. We needed two for every class that we had, because we needed one to run Lucina and one to run newborn Hal. And again, for the most part, we've had through our simulation program pretty good support with that, but we've had some issues with some challenges with staffing on that, and again, it's brought to the need, and Kim is aware too, of deepening our pool of sim operators, and what we need to do so that we have a little bit more flexibility in that regard. And then last but not least, really in the background, you've got your equipment in your space, you've got your bodies, but you still have printing, office supplies, managing registration, rosters, directions, parking, check-in, that sort of thing, and who's going to do that. We were fortunate enough to have a program coordinator when we first rolled this out in the beginning of the year. We had her for 2 of our classes to really help kind of behind the scenes that we could delegate this activity to, and that was great. But after 2 classes, that role was changed and actually removed we didn't have that support anymore. So in the meantime, we kind of had to parse the work out. We've kind of patched it up, but we have some other folks who are able to help support us with that, and that's been fantastic, and Erin and I have had to take on some of it. But we're making it work. And through our system program here, there is some restructuring going on, so we know in 2018 that's going to look different as well. They're really looking at how administrative support and program coordinator works throughout our system. So that'll be revisited, but we just have to keep in mind or kind of keep the message out there that we're going to need we need support for this program to keep it sustainable. And last but not least is really our evaluation. You put this whole program together, and then you really want to know, are you meeting your metrics? Are we getting what we need? Are we suiting the needs for the students? So we developed a survey monkey that we have the students complete at the end of every class. We pretty much make them complete it before they get their CEUs, and that way that we know that it's being done. And so far this year, we've had 76 responses to our survey monkey out of, I think, 84 students that we've got that have come through. We only have 5 questions. We've made it very short. In addition to the date, we asked them really to give us an overall rating from 1 equaling poor to 5 excellent, and our rating overall this year is 4.5, so we feel pretty good about that. We also asked them to give a rating to each of the stations, and pretty much specifically saying things like, after attending the postpartum hemorrhage scenario, I'm able to utilize the checklist, and again, the rating from 1 to 5. And on each of those stations, we have an overall rating of 4.4. The one station we did notice that there was sort of a lower rating on was the Leopold's and fetal monitoring station, and really looking back, we realized that that was probably because we had actually more postpartum nurses attending and postpartum only nurses attending this class, and of course that material isn't terribly specific to their work. So again, a takeaway, we've already decided that we're moving forward, we're going to remove that Leopold station, and we're going to put that in a different class, in our labor class, where it's really more specific. And then that's why we really expanded into that newborn hypoglycemia work and really working even more with the diabetes for those staff. Another with key takeaways, and some of those are shown here on the slide. These are some of the takeaways that were actually from their survey monkey. So really communication, again, great class. They realizing that they can call for help, knowing their resources, and they're feeling more confident in that. And then we asked them as well for some future planning or some ideas. And some of those we've been able to take into consideration as we're planning 2018. I just wanted to say, too, or add that how to communicate and handle emergency situations for us was a huge one to see them acknowledging. The needs assessment that Kim had mentioned, excuse me. Mary, when she first started this work, went out to all the sites and spoke with the leaders, the educators, the preceptors, and the orientees about what their gaps were. And one of the big things we saw when we first started was that there was a big gap between the regionals and the metros as far as how much experience they had in emergency situations. And that was causing, we think, a lot of the variation in length of orientation. So really trying to get the regional nurses exposure to these emergency situations so that they weren't staying on orientation until they saw one was a big part of our goal. And so seeing that come through on the evaluations was a huge success, I think.
So in summary, as you can tell just from the content that we have explained to you guys, this has been a huge collaboration effort with some of our best educators, I think, in the system. Erin and Kathy have a ton of experience in simulation. They understand how to write a scenario, how to present it, how to debrief really well, how to pre-brief and debrief really well, and how to use the debrief after that questioning to really do some great teaching and drive those topics home for our participants. We had our content experts, we have our leader support. We really had to have the backing of the mother-baby service line leaders and the managers at every site to send people out because they all have to drive, all the way from New Ulm or, from Regina Hospital in Hastings. We had to get those nurses all to Abbott Northwestern Hospital in the city, and for a lot of folks that's daunting, a little scary. You don't know who you're going to be with in your group. It's a mixed group of labor delivery and postpartum. So it could be anxiety producing and having to perform in a simulation. And actually we have been so impressed with our nurses, our new nurses that are coming out of academics, out of their schools. They're prepared. They jump right into the simulations. I mean, we talk about safe learning environment, things like that, but they just jump right into the simulation, start talking to the patient, interacting with her. They're just all ears, and they're just soaking it in. And by the end of the sim, they want more. Like initially, they're like, we want to take this farther. Like, we want to use the Bakri balloon for postpartum hemorrhage. We want to get our hands on that. And so even after the first class, we started to kind of advance that scenario, the postpartum hemorrhage, so that sometimes it goes really far, and Kathy's playing the physician, and she's putting in that Bakri balloon, and they're all checking her vitals and doing all their stuff and learning how to assist her in using the Bakri. And so when we have these events, some of our newest nurses are prepared, and they're comfortable, and they're ready. So again, just great leader support, great content experts, and then as Kathy mentioned, we're always reevaluating our program. Pretty much any time, I always tell my new facilitators, anytime you do simulation, you always say, all right, let me debrief my own performance, and how did I run that scenario? How did I debrief it? Did it flow? Was it what we needed to do? Was it what the learners needed? So we're always looking at our content, seeing how we can make it better and more on point for them, and then just being so flexible. We had a situation a couple of months ago where Lucina all of a sudden wouldn't bleed, and we were using just one of our Lucinas for that day and flipping her from her birthing belly to her postpartum belly, if you know Lucina, and oh no, we have 10 minutes before they go in. And we had our second Lucina sitting close by, so we whipped them around, switched beds, and in 10 minutes we had our second Lucina bleeding, and we were ready to go over the scenario. But it took okay, everybody come in here, hurry, we got to flip this over. All hands on deck. So it takes an incredible amount of flexibility and preparation and knowledge. And I have the best of the best, I think, here at Alliance. So I think that's why we now have our other specialties. So as this specialty orientation process is going throughout Alina, we've got our critical care area now working with Mary Olson and pulling me in as their simulation consult to say, we want to do a day like this. We want to provide this kind of education for our new critical care nurses. So how do we do this? And OB continues to be the model for how we can do that. Granted, it's going to look different for OR. You know, we won't be doing this as many times a year. Critical care, we're doing a number of different scenarios, and it's primarily simulation-based. But they really look to this as a model and are very excited about the idea of providing this education to specialties. So in summary, we just hope you guys enjoyed this. I hope you got a few nuggets to take home to your unit, and we want to know if you have any questions for us.
Any questions, go ahead and type them in the chat and we'll watch those. Anyone? All right. Thank you, Sue. Thank you, Betty Jo.
Thank you.
One of the things I was just thinking about as I was listening to Kathy and Kim talk was our facilitators. We've really changed, as we've been talking about deepening that pool, we've really gone to different facilitators as well. We used to historically use all OB educators or supervisors, and we really have started pulling in and mentoring and growing our staff nurses, I would say. And I think that is good and challenging at the same time. As Kathy said, you want to really make sure things are consistent in their delivery. But that dry run we did with our facilitators was really key, and I think it helped us recruit more people once they saw the small groups as well. I think what we got for resistance from staff members from presenting in the past was that they didn't want to present to large groups, whereas things like this, where it's small group discussing things, where they have topics to touch on, where they have a facilitator guide that supports them, where it's not up to them to know everything, really helped us recruit a different pool of people. And if anything, I would say our staff nurses who use the facilitator guides follow the facilitator guide more closely than our educators who have maybe more experience. And so that's been a really great pool to pull from.
It's almost like creating a safe facilitating environment.
Yeah.
You have your safe learning environment, but you also need your safe facilitating environment.
Well, and then the nice thing is, too, then all of those staff members take that back to their unit and help promote that best practice out on the unit as well.
Exactly.
Right.
Exactly.
Oh, yeah, exactly like Betty Jo said.
I think that's one of the things too. We're starting to look at growing our simulation facilitator pool, and that's primarily one of the biggest things I do at Alina is teach on the modality of simulation. But I always talk about in this class, this kind of opens a whole new world for you. If you are interested in education, we're giving you all the tools to be a simulation facilitator, and we're following the standards of best practice from ANASCO. So we feel like we're giving them some really solid education on how to facilitate, how to use simulation, and so we're looking at growing some more of our OB nurses to help facilitate them.
Oh, thank you, Ashley.
Thank you.
That's very kind.
Yeah, thank you.
Appreciate that. Does anyone have questions about any of the logistics or any of the decisions about topics?
All right, so I think we'll hand it over to you. Yeah.
Just unmute my microphone then. That was just fascinating to see the work that you've done and how you've put all that together. I could see that also being used in academia, perhaps not in as an intense mode, but just having those different units and different kind of a progression between different simulations. It was absolutely fascinating. Thank you both so much, or all three of you, for that. Before you go, I just want to share that we do have, let me find this, you'll find that there is a survey PowerPoint and it's just one PowerPoint long, and it gives you the link to our survey. And if you would fill that survey out, it's a very short one, and then at the end there will be a link to a certificate of attendance for you for this session. Once again, I want to thank all three of you for your presentation. It was just fascinating, and I hope that you all have a wonderful day. I think that's it.